Okay, our guest this week is Simone, and she comes without a whole lot of things that have happened to her, which is great. But her knees bother her, and she really is all about a healthy, active lifestyle. And knees bothering you are not a good thing. So she wants to see what we can do to help that be a little bit better, so that she can do more working out and just be more active. So I'm Kara Lindell. I'm the founder of the Bridging Institute and the Bridging Technique, and comes from my background as being an engineer and a movement specialist, and we take a really different look at how the body works. It's problem solving based on how the parts work together and how they flow and transition. And so that's what we're going to start off doing, is doing some checking and see what's going on. So first of all, just stand here and we're going to see how you move. So I'm just going to go a little bit from side to side, and she's not helping, and that is actually really nice. And then we're going to see how she turns and comes back to the middle. Very nice, very symmetric, and then forward and back. Okay, back could be a little bit better. So what's interesting, I don't know how this is going to play into what we find, but she's fallen a few times over her lifetime, like flat on her back kind of falling, with rug being pulled out from underneath her, falling off a ladder, just really weird stuff. But the more interesting thing that I think is going to play into her knees, and we'll see, is when she was a kid, she had a hernia surgery, like both of the hips, and usually it's a little tight after surgery. So if it's an adult and it's a C-section or something like that, we're going to expect the tight hip, and that can cause some knee pain. So we'll see what's going on there, but I don't know how the injuries from falling are going to play out either. So sit down. Let's see how core is working when you're sitting. And we're just going to go the same way, side to side. Okay, so she goes a little bit more to the left than the right. Can you tell that difference?
Yeah.
And then turning is super easy to the right, not as easy to the left. So it's almost like the best position for your legs and core is a little bit turned and a little bit to the side. And that is not going to put her knees in the best orientation, nor the hips. And then let's see about forward and back. That's good. Feels like the left is a little bit tighter, and it does feel like it's a little bit at the hip. Does one knee bother you more than the other?
It's the left.
Okay. So Simone, let's, on your back, you can put your head right here, and let's just check out how some legs are working. I'm just going to lift and just seeing how easy each one. Okay, so I'm also going to see how they turn. So right turns in, doesn't turn out very much. And left turns in a lot, and it actually, it's hard to get it really back to the middle. It wants to be oriented in just a little bit. So whatever we do today, hopefully we can get that left leg a little bit more centered. Ideally if they turn in and out, that's the best, but whatever it is, we want them both to match. Mm-hmm. And then let's just do a quick check with arms. And then nothing's bothering you there. Okay, perfect. Yeah. I like to make sure, because people tend to forget things. This one, awesome. Now this is a little tighter. I don't know if there's a particular reason for that, but we will see. I'm just going to see how ribs are moving. And then how you're moving here. Okay, it moves equally left and right. So it doesn't seem like it's from your core. Let's see about shoulders. I'm going to scoop underneath. So this left side moves a little bit easier than the right. It's almost, I wonder if this is part of the falls, because it seems like your core is shoved a little to the side and a little bit around. Mm-hmm. Does that match any of the falls of what happened? Or you don't really remember?
Well, the ladder fall could be, I felt like while the ladder was falling one direction, I was falling like in the middle of the basically V shape.
Yeah.
But I don't remember which side exactly, like more kind of flat-ish.
Yeah. Okay, I'm going to grab an arm and a leg. I'm going to roll you a little bit toward me. And shoulder doesn't really move very much. So I know it's not bothering you, but there's something about that right shoulder that is just a little bit tight. And if it's got your core off center, that could be another thing contributing to the knee. And then let's see about this side. Okay, that moves so much easier. However, that's the orientation that that leg is going in with as well. So not sure about that. Flip on your stomach, roll over that way. And let's just check a couple other things with legs. So I'm gonna just lift each one. Okay, I am sensing the thing with your knees. My goodness. When I lift here, just real easy, this is where your knee says stop.
Mm-hmm.
I would like it to bend a whole lot more very easily. And this one is about the same, but the angle's a little different. Okay, so I am going to bend it because they do bend. And then let's see about your hip. Okay, hip is actually pretty easy. Does any of that bother your knee?
No.
Okay, and then we're going to see if your hip goes out like a frog leg, and it does not. Wow, it is very tight. And this one, okay. I cannot, there's a difference with your hips. So the right one, I'm lifting straight up and it lifts. So can you sense that?
Yeah.
So direction makes a big difference. So this one is going straight up. This one, when I bend and try to lift straight up, actually swings out.
Mm-hmm.
Feel that?
Yeah, yeah.
Yeah, so whatever's going on between the hip and the knee is not, you function just fine and it looks fine, but you're getting stressed, and that's what you're noticing, especially in that knee. Let's see how this turns. Okay. The left side is tighter because I can turn from the right and it moves. The left side doesn't move. So often with surgeries, they can be not the same. One can be sewn up a little bit tighter, could have pulled muscles together to pull it back, or the hernia was more pronounced, like there was more to it. Let's just check the shoulders. It's funny, the one that was tight when you were on your back is like maybe a little too loose. But they're actually pretty equal. So tell you what, flip back on your back. And so here's how we're going to test to see if we're on the right track of if that hernia surgery played a role. Mm-hmm. We're just going to support it and see if that actually lets it move more easily. So I'm going to get one of my little peanut balls. It's soft, and I'm going to just put it here. I don't know exactly where the scar was, and you may or may not, but I'm just going to hold, and we're going to see if that lets your leg turn differently. Okay, compared to, yeah, it doesn't go in as much.
Okay.
So here it goes in and then back to middle, but not quite middle. And if I put some support here, that's not too much, is it?
No.
It doesn't go in as much, and it actually starts to come out a little bit. So what I'm going to do is we're going to support, because the scar's there for a reason, scar tissue. It was needed at the time. It helped put your body back together, but it also acts like a barrier. And so we want the muscle flow to connect through that and like incorporate that, so it's not just a hard stop. And so I'm just going to use this as a support and just kind of help both sides. Shake hands, be nice, greet each other, and figure out a new way to work together. And then I'm going to also hold your leg because we have a few different angles to try to get it through. And boy, does it really like to turn in. There. So what kind of exercises have you been doing to keep your knees going?
deadlifts and squats with heavy weights.
So trying to keep the muscles around the knees stronger?
Yeah.
Yeah.
And different balancing exercises too.
Good. So those will all still be good, but for a different purpose. Keeping muscles strong and bones strong. There. So her hip is really starting to move a whole lot easier. And feel how it's starting to turn?
Yeah.
Yeah.
Wow.
So one question that does come up pretty frequently is like, okay, we have it moving. How long is that going to last? Because this is scar tissue and we're just reacquainting muscles on each side, there's nothing else to have to teach it. Your muscles knew what to do before this all happened. And so if you kind of think in terms of muscle memory, what we're doing is just allowing them to work together again. Okay. So they've got the memory. They've put it together when you were a little one. Here. And so the way, with as tight as your hips were, you would have been hard-pressed to sit crisscross.
Yeah, it was never easy.
No. So that may be something that you'll catch yourself like, oh my gosh, I'm sitting on the floor and I didn't even realize it. And there. Okay, so I'm not supporting her knee anymore, and all the transitions are just flowing really smoothly right through there. And the right one wasn't as bad, but it wasn't so good. So we're going to do the same thing over here. And just, oh my gosh, that's super easy. I don't think the right one was so affected. Do you know anything about the hernia surgery, if they needed to do both sides, or did they need to do one side and just did the other one because they
said it was double hernia.
Okay.
That's what I remember.
Because sometimes, especially with kids, if there's a hernia with one side, they'll do the other just so that it's done.
Mm-hmm.
And sometimes that's the side that actually is more problematic because there wasn't really anything wrong with it, or truly wrong with it to start with. Here. Yay. That is super easy and nice, and they feel pretty similar?
Yeah.
Okay, let's see if pick up a couple of them. Well, I want to see if that changed your shoulder. Yeah. And see about your arm. Oops, sorry. Good. Yeah, actually it did. That's so interesting. And this is where I noticed your shoulder. Yeah, oh my gosh. So seemingly a lot of the tightness here actually cause some tightness restriction up in a diagonal way through your core. So sometimes it's interesting to see how restrictions play out. Mm-hmm. Roll back over. Let's see if the hip cleared up. And okay, so this one was great on how it lifted, but I couldn't get it to go to the side at all. Okay, I'd like a little bit more than that, but at least you have some sideways motion and some rotation there. Okay, but let's see what really is going on with the left. So as I lift up, it's going straighter. You know, this has been off for so long, your muscles are like, oh, the only way they know how to do this is to kind of come out to the side. So I'm going to take them out to the side and just playfully kind of help them find some new places they can work together. And here. Let's see if we can get that hip to rotate. Ooh, that's super tight. So Simone, what I'm going to do is let you put this like right underneath here on the left side. And let's see if we can get just a little bit more. Yeah, thanks. Just a little bit more motion there with some support. Oh, well, how about that? That was like way too easy. Okay, so then let's take the support out. Oh, love it. Wow, that may be easier than the right.
I could feel like there was an internal, like almost like a click.
And just like opened up and
yeah.
Okay, so let's see how the right, oh no, okay, so let's do the same thing on the right. There you go, thank you. And I always think of muscles being like people. It's like you make an introduction and then they get to know each other and then they can play and work together. There you go. Okay, take that out and let's see how we are. Perfect. So what I want you to do, just to see if we're pretty close, is this leg, just lift the whole thing up and then put it down and then lift this one. Are they pretty similar?
Yeah, feels like it.
Okay, good. And then just to go back to our original with the knee, I'm going to lift from the same spot. See how easy that bends? Mm-hmm. It doesn't catch at all. Same thing with this one. So the fluency of the knee really opened up as the hip opened up. So roll back over. And let me make sure that we are connected up to the core nicely. Very good. And beautiful. And then sit up and we'll see if you're a little bit more centered. Can you tell the difference in how easy you're moving?
Yeah.
And then turn. Oh my gosh. Wow. She could move before, but bigger range of motion and just so much more fluent. Stand up. See how the core control is doing. So holding here. Okay, I don't feel that tightness on the left side anymore. And really fluent. Awesome. Do you feel like your feet are gripping the ground better now?
Yeah, a lot. Because I always, like, could feel there was a restriction and that's gone now.
Yeah. So before, when I would move her forward and back, it was almost like her feet were going to be giving away and she was going to fall. And now it's just like, oh, they've got it. So sit. Let's just kind of review. So what we found is she wants to keep her knees working a little bit better, and they were kind of stuck. But it really went back to what was going on at the hip. Knee is never usually the culprit. It's usually the foot or the hip. And so just supported where the area that she had had surgery many years ago. So you think that, oh, but it happened so long ago. Well, it still affects you. And all those muscles were learning how to talk together and work together again. So they could go forward, sideways, turn, all the different ways that they need to work together. And she should be good to go. I'd love to have you come back again so that we can check in and see if there's some fine tuning or if you're doing some new yoga poses now that you need a little bit more. So anyway, if you enjoyed this example of knee pain from the hip, give us a thumbs up and subscribe to the channel so that you can see all the new episodes as they come out. Thank you, Simone, for being here. What a great example.
Thank
Love
you so
to
much.
keep you active.
Thank you.